We start now our presentation about, it's an informative session about the use of FAIR principles for biomedical research. This presentation will be in English because it's a normal language to communicate in science. And okay, my name is Carlos Parra. I work in the University Hospital, Virgen del Rocío University Hospital. I am the head of research and innovation of biomedical informatics, biomedical engineering and health economic group in Institute of Biomedicine of Seville. A lot of you don't know us because we work out of the Institute of Biomedical Research in Seville. We work in the Centro de Documentación Clínica because we close and collaborate with informatics department of the hospital. Currently, I am the consortium coordinator of FAIR4Health project, and this sense we develop strong activities about FAIR principles in healthcare domain, specifically in health research and so on. Also, my colleague Kiko Núñez worked with me in our group, and he's the operative consortium coordinator in the project. And we present today between us the main aspects about the how can use FAIR principle, explain some details about this and so on, and focus on our project. FAIR4Health project is Kiko explain some more details, but it's a project coordinated by Andalusian Health Service, in our case, our group, and in collaboration with the internal medicine department of this hospital. Some clinician and research, clinical researcher of this department work with us in the project, led by Dr. Manuel Ollero. Okay, but now my explanation will be about the FAIR principles. This is the outline of the presentation. We have 1 hour to show the presentation. At the end, we will try to get some minutes to discuss some question, suggestion, etc. Okay, what does FAIR stand for? The FAIR guiding principle will present for one article very famous now in the journal Nature. And the first author is Professor Mark Wilkinson. Mark Wilkinson works now in the Universidad Politécnica de Madrid. He's not Spanish, but now working in Spain. And I think FAIR principle is it's a declaration about how must use the research data in general in science. Not FAIR principle is not specifically about health. It's about in general health data science. First principle is in the framework of the open science. It's a very important initiative in the framework of open science, but it's not specifically about open data. At the end of my presentation, I explain some details about with one slide about the difference between FAIR data and open data. It's very important because we have a lot of misunderstandings about at the end, all the electronic health record of a patient we can share with the world. No. Be careful. FAIR is a set of principles to improve the how can share, reuse, interoperable, etc. Data in a very explicit, a clear process and level of license, authorization, etc. But it's not all data will be open for all try to access. No. This is not this case. We know some of our partners in the is very focusing how can at the end we will achieve the open data of all health research in the world. But today we have a lot of circumstances, socioeconomic factors very important, and the law also. It will be very difficult in short time how can achieve this kind of objectives about the open data. Okay, the FAIR principle. The first principle is to make data findable, encontrables in Spanish. Every main principle is separate in more specific principles. At the end, we will speak about two kinds of data: the real data, data of research, data of healthcare, and metadata. Metadata is the data about data. Is a very important and tool element in this sense, because we will use metadata to achieve the objectives of FAIR principle to use. Always we will see data and metadata and separate, because maybe in this requirement or this principle is about meta and about data. It's only about metadata. We don't use the parentheses. What do you say? Parentheses? Brackets. Brackets. Okay, sorry. Without bracket, is the principle is only about metadata or only about data. But if we use bracket, it's about the two elements, about metadata and about data. Okay. This first principle is about meta and data are assigned a globally unique and persistent identifier. Okay? It's slow. The second is only about data. Data are described with rich metadata, defined by requirement 1 below. The third requirement, metadata clearly and explicitly include the identifier of the data they describe. The fourth, metadata and data are registered or indexed in a searchable resource. Okay. In summary, the main first principle findable is developed with four requirements. The second main principle is about accessibility. The data must be accessible. Okay. The first requirement about accessibility is A1 requirement. Metadata and data are retrievable by their identifier using a standardized communication protocol. This requirement is separated in more details with specific sub-requirements. The protocol is open, free, and universally implementable. The protocol is open, not the data is open. The protocol allows for an authentication and authorization procedure where necessary. It's not open. Metadata are accessible even when the data are no longer available. The third main principle about FAIR. Interoperable. The first requirement about interoperable principle is metadata, and data use a formal, accessible, shared, and broadly applicable language for knowledge representation. This next requirement is metadata, and data use vocabulary that follow FAIR principles. Next, metadata and data include qualified and reference to other meta and data. Okay, and the last main principle, reusable. The first requirement about reusability is metadata, and data are richly described with a plurality of accurate and relevant attributes. In more details, sub-requirement, metadata and data are released with a clear and accessible data uses license. Next, metadata and data are associated with details provenance. Next, metadata and data meet domain relevant community standards. And this is the last. This is the Human Rights Declaration. And these principles, since 2016, developed a strong scientific activity in a lot of research community in the world, and specifically now our European Commission take the drive this FAIR principle, very important for improve the science in Europe. Okay. Specifically in Horizon 2020, we can see some news about the, in this case, is the Commissarian, Carlos Moeda, about the importance of FAIR. You can see one workflow on how can FAIR principles can improve and accelerate the research. For example, we know, I don't know if you know the initiative medicine, innovator medicine initiative, the call of European Commission and FPA. FPA is the Association of Pharmacy Pharmacy companies in Europe, and FPA and European Commission fund a lot of research projects, with very high funding, and FPA have a very strong interest in how can apply FAIR principles in the result of IMI project funded by IMI program. Why, in a practical way, why is important FAIR for you? I think a lot of you now work in preparation proposal from Horizon 2020. Today, in the current work program open now, you can identify the requirement for use FAIR principle in this set of topics. In the current program of societal challenges about health in Horizon 2020, you can take the work program, find the word FAIR, and it's very easy to identify. FAIR now is very important, and in the future Horizon 20 Europe will be one main and essential requirement to implement projects if the funding is from European Commission. This is very important for you. you need know very well FAIR. In this slide, we can see some reference about the use of FAIR in health, because FAIR is not specifically in health, but health is a very important domain to implement FAIR, because health is very important domain in the science in general. Specifically, bioinformatics in genomic research have started the experience to use FAIR, because maybe we need a lot of information and how can connect different information about his proposal to genomic research. And we can find a lot of reference about how bioinformatics use FAIR, but it's not only about bioinformatics, in general about health research. We can identify some important association, organization at global level, mainly RDA, Research Data Alliance. The Research Data Alliance is a global association to implement the open data, etc. And Research Data Alliance take the initiative of how can develop the use of FAIR in the world. And in RDA, in this case, we are member of some specific group about how can implement FAIR data in health research. And we can see the evolution of FAIR data in PubMed, the concept. And we can see some statistics about some figures about FAIR in health research, biomedical science, and medicine. Okay. And my last slide, when I saw is about we must be very clear the difference between FAIR data and open data. In our case, in our project, we share information not only about some specific research project. In your project, we share information about electronic health record of Virgen de Rocío University Hospital and other hospital, the Hospital of Geneva, share also his electronic health record. It's impossible in your understanding of the healthcare provider, the law, etc., share information about healthcare. Also, we have a lot of legal, ethical issues in the project. For example, one partner of the project is Garrigues. Garrigues is a larger company, very famous in Spain, because we have a lot of legal issues, not only in Spain, it's in the rest of Europe. And a lot of partners from European Union, and the GDPR is applicable, but we have two partners out of European Union, Switzerland and no, three partners, Turkey, Switzerland, and Serbia. It's not applicable GDPR. We have a lot of issues about ethical, about lawyers, etc. FAIR data is not open data. FAIR data is an instrument to handle, to manage data. We can facilitate and support the findable, accessible, interoperable, and reusable data, but in a context very explicit with if we have some level of license, level of authorization. The idea is to apply FAIR data is how can identify very clearly how can, if I can use some data, I can see the process to access and share the data. But it's not open data, data in Google, for example. This is not this case. In any case, we need grantees have the right to opt out at any time, but they need to say why. Those three reasons for opt-out: intellectual property right, privacy, might jeopardize project's main objectives. I finish now my presentation. Next speaker will be Kiko. Kiko start with the more details about FAIR. At the end, Kiko show our project. Thank you very much for your attention.
Thank you, Carlos, for this first part of the presentation. Well, I will continue showing a little bit more about what are the FAIR metrics, or how can we assess that a dataset or a repository is FAIR compliant. And we'll also talk about the FAIR repositories. Well, the first thing I wanted to show you is this FAIR metrics website, which is being developed by the same authors of the paper that published the FAIR principles. So let me see if we have, here it is. No, maybe it's not opening. Okay. In any case, I have the summary here in the slide, so maybe we don't need it. See? So in the end, for each one of the FAIR principles and sub-principles that Carlos showed in the first slide, there is questions regarding of if a data set is compliant with these requirements. In this sense, what these authors have proposed is to make several questions related of each one of these points, and depending on the outcome, decide on whether it is fair or it is not fair. So they have also tested these metrics, which are available in that URL. This presentation will be available for all of you who want to have it, so you can check it afterwards. But as I was saying, these metrics were tested against several well-known open data sets like tidyverse and those that are shown in that table. And as you can see, when a cell is colored in green, it means that it passed the test. In red, that it doesn't. And in yellow, that there was a misunderstanding on the way that it should be answered, that question. So, so far, these repositories, which are very well known by the research community in several fields, not only in health, as you can see, none of them is completely fair according to the FAIR guiding principles. Okay, having said that, about the repositories, the European Commission mandated to a high-level expert group on FAIR data to make a report. In this report, they were addressing how to make FAIR a reality in the research environment. As an outcome of this report, they released several recommendations. We found two of them which are related to the repositories. The first one is that they recommend to deposit your dataset in trusted digital repositories, and when possible, those with a mission and expertise to support a specific discipline or domain, so researchers from other institutions could have an easy access to these datasets. And the other recommendation has to be with the assessment framework and at the end the trustworthiness of these repositories. There is an assessment framework which is endorsed by the core trust seals, and this is very well known. And in the end, what they recognize is that this repository is will be always available and will have a quality, enough quality for the research community to be used. Some of these repositories that you could find data sets that could be useful for health research are shown in the slide. such as FAIR sharing, re-free data, and you also have a list in the Scientific Data Journal, which is part of the Nature editorial line. You will have a more detailed list about health data repositories. So, moving forward to the next part of the presentation, now I will talk to you about the use case of our project, which is called FAIR4Health, like Carlos said. And the full title is Improving Health Research in European Union through FAIR Data. The consortium of this project is made up of 17 partners coming from 11 European and non-European countries. Like Carlos said before, we have also partners in Turkey, Switzerland, and Serbia, which are associated countries but not fully European countries. In this consortium, we count, which is coordinated by the Virgen del Rocío University Hospital, by this hospital in Seville, Spain. We count with 6 entities with a strong background in health research, like our hospital, like the University of Genève and the University Hospital of Genève, the Instituto Aragonés of Ciencias de la Salud, which is also involved in this project, and other universities and clinics. We also account with 2 partners with a very, very strong expertise on research data management, like the Digital Creation Center in Edinburgh and the Universidad Carlos III from Madrid. And also 4 partners with which are experts in health informatics domain. We are supporting the definition of all the developments that will come afterwards. And finally, some 5 business actors in this environment, such as Atos Company, which are developers, the HL7 Foundation, which is a standard organization in health informatics, the European Federation of Medical Informatics, Garrigues, the law firm that Carlos referenced previously, and SRDC, which is an SME from Turkey, which is devoted to the development of e-health services, let's say. So the objective, main objective of the project is to facilitate and encourage the European Union community of health researchers to verify, which is to translate to FAIR, and reuse their data sets coming from publicly funded initiatives. So in doing so, we plan also to demonstrate that we will have a beneficial impact in terms of health outcomes and health research. So we will tackle this objective by 4 different actions. The first one is an outreach strategy, which is raise awareness in the research community about the use of FAIR data. The second one is to provide the researchers, or to indeed what we are doing is adding our expertise and our work to the current background on the FAIR certification roadmap. There are a lot of initiatives at the international level that are establishing quality criteria and the rules of the game, let's say, for this FAIR issue. And following that, we will develop a technological solution that we will be pilot in several clinics, including the Virgen del Rocío University Hospital, that will facilitate this work to the researchers. And finally, we end up this project with demonstration in 2 different use cases that we could get this impact, this beneficial impact in terms of health research and health outcomes. And we plan to do all of this with roughly 3 million euros, that if you split it down into 17 partners, you can see that that's not a very big money. But we are doing what we can with what we have. That's all. So the use cases that we plan to perform during the project, the first one is related to the researchers, because we want to support the discovery of disease onset triggers and disease association patterns in comorbid patients. So we are going to provide a tool to the researchers that after looking into all the data sets that I will show you later on that we have available for the project, can provide this kind of these patterns in these patients. So they could also guide their investigation thanks to this tool. And the second use case is a more practical and more related to the healthcare environment, and is to develop a prediction service of for 30 days readmission risk of COPD patients. And we will also develop this service upon the data sets that we have available for the project. So I was talking about the data sets. Here are the data sets. Altogether, we count with 8 different data sets coming from 5 different institutions, which are coming from Spain, Italy, Switzerland, Portugal, and Serbia. We are taking into account in these data sets, some of them are coming from research, so they are with a very high quality. They have gathered very good quality of data. And we also have the electronic health records or hospital information systems from 2 hospitals. One is Virgen del Rocío University Hospital, and the other one is the hospital in Genève. It's another university hospital. In any case, the quality of the data sets that are coming from healthcare environment are not supposed to have the same high level of quality than the others for research. So we'll have to face that challenge during the project. Well, altogether, we count with about 5 million of different registries among all the data sets. So it's quite a big quantity of data to be investigated. So this is the last slide about which is the FAIR4Health project and the vision. And what I wanted to summarize here is that we are trying to build an open community from 3 different key actors in this environment. On one hand, the health research institutions and their researchers would be the basis for the community. On the other hand, we want to add to the developers of e-health services and solutions, so they can build their tools upon the FAIR data provided by the researchers. And finally, which will be the benefit, will have the benefit of these services, innovative services developed, the healthcare providers, the hospitals, clinics, and so on. So, well, this is the summary of what is our vision. We put the focus also that we want an open community. We want to involve as much entities and researchers as possible. So make it as big, the bigger the better, I think, because we are talking about sharing and reuse. So that's our intention. Well, now I will explain one of the earliest outcomes of our project, which is the verification workflow, which talks about how are we envisioning that this translation to FAIR should be performed. So in the origin, we have quite a lot of data related to health from a subject or several subjects. We are taking into account electronic health records, information, laboratory information, sequencing, genomic information, imaging, but also information from social networks, from wearables, and for mobile applications. That all this information we find that is useful to perform research over it and help advance the research community. But we have a problem. All this information comes from very different sources, and what we need for research is to have all of them very tidy, sorted, and ready to be used by the researchers. So that's one of the main objectives of make this data FAIR, indeed. So What do we do? Well, the Gulf community, sorry, it's here. Yes, the Gulf community has already published this process, this verification process or workflow that takes into account 6 main steps, let's say. Once we have the raw data, what we have to do is to analyze it, access it, and analyze which type of data are we watching. Afterwards, we must make a semantic modeling depending on the type of data we are using. We may use different terminologies. After that, we have to make this data linkable, so it could be accessed and browsed from other sources. Afterwards, we have to provide this dataset with a license. So you can state this dataset could be used for free, or you can use it, but you have to cite which are the owners, or you can only use it if you contact with us and we sign an IPR agreement or whatever kind of license for reusing data. And after adding this license, aggregate all needed metadata for provenance. For instance, if we are talking about lab tests, you may need to specify which kind of matchings have processed the samples or the blood, and which date, and all this metadata that could be useful for keep the quality of the research. And finally, archive that data set in a well-known repository, so it's available for the research community. But as I was saying before, we are talking about health data coming from very heterogeneous sources, and the quality of this data is not always as good as we would like it to be. So we added a first step in this workflow, which is dealing with the curation and validation of these data sets. For instance, when you browse into clinical texts and you want to extract some information, you have to deal with typo errors and some, well, you know, we are humans, and when we write free text, we have some errors that must be curated before processing it into the research. Well, after this step of create and validate the data, it's very important that we have in mind that we are dealing with very, very sensitive information. Health information is considered on the top kind of sensitive information by the GDPR. So we cannot process any information related to health without anonymizing it properly. So we must add this layer in this workflow. I think I didn't say it before, but Gopher proposed this workflow in the blue boxes of this workflow in an agnostic way, disregarding the type of research or the research domain. So that's the reason why we are adding these green boxes, just to make it comparable or applicable to the health domain. And we have also added a last step, which is related to data versioning, because health information is not static. At least it's not static in the healthcare environment, where patients are coming to several follow-up visits and so on. So we must keep a data version mechanism to make this data consistent over the time. So we are coming to the end of the presentation. I expect to not be boring you very much. After getting the end, what we are presenting now are the guidelines that the FAIR4Health project has so far developed, and these guidelines are directed towards the health research performing organizations. So these are like tutorials, guidelines, to practically implement a FAIR data policy in their organizations. So we have split this guideline in principles and steps. So the principles, the first one, the strategic vision. To implement this policy, this fair data policy in health research environment is a very complex change that need to be well managed, and of course it needs to have a leader to put it set it forward. The second principle is about resources. You will not have um, any implementation of FAIR or nothing without resources. And we are talking about human resources, but also technological infrastructure. Both of them are needed to make this happen. The third principle is about the skills. In your team, if you are going to implement this policy, you will need people with the strongest expertise in research data management, but also in health data management in this environment. So you will need to think about hiring a team or at least one person for this purpose. Otherwise, you will not make it let's see, in a good way. Also, you need an action plan. You have to put yourself objectives and delimit which is the scope that you will address, and so on. And finally, which is I think the most important, is the approval. You need to have this policy approved by the government body of your organization. So they really endorse this change. So these are the principles. And now I will try to summarize as much as possible the steps that the FAIR4Health project has developed for this purpose. The first one is about the vision and objectives, and you, as we said before, you also must define overcoming mechanisms to tackle all the challenges that this implementation will have. The second step, to assign or to name a responsible team. The third one would be to raise awareness in your community, to spread the voice and tell everybody that you are implementing a fair data policy. So you could engage also the researchers in your institution to make to contribute to this policy. But as we said before, we need a data infrastructure. So you have to provide with tools, with suitable tools to do research, to your researchers, so they can make this implement this policy effectively. So they could make their data fair. And also you have to stick to the good practices of research data management. And one of them, and which is also endorsed by the European Commission, is to provide an institutional template for data management plans. That's also very, very advisable. The sixth step is the openness. You have to declare which is the level of openness you are going to for your data sets that you are producing. As we are talking about health data, we assume that it will not be very, very open, but at least what you need to do is to set and put it crystal clear, which is the process by which all external researchers could access your data, or at least ask if they can access, let's say. The seventh step is standards, use of technical standards. If we want to make data interoperable, we must stick to technical standards that are commonly used in your domain. In health data, in health domain, for instance, HL7 standards or IET are also very well known. Number 8, incentivize. If you want your researchers to produce fair data, why don't give a reward to them? It should be a good starting point, so you until you get a core community of researchers verifying data. So it's an option and very advisable for researchers, of course. The step number 9 is the implementation. So write a policy, submit to approval, and disseminate it through your organization. And finally, the last step is assess if your policy is working properly or if you may need to fix something because it's not working well. So cyclically, it's advisable to make an assessment of your FAIR policy. And well, that's all. This is the last slide, in which I want to summarize 3 key messages to take away. The first one, if you are not going FAIR, you are not going to gather European Union funding. European Commission is endorsing and supporting and encouraging all research community to adhere somehow to the FAIR principles. So if you want to make research at European level, you will need to be FAIR. Well, the second message is, as Carlos said before, FAIR is not open. This has led to a lot of misunderstandings in the past, recently, because this initiative is just 3 years long. But FAIR is not open. FAIR data could be open data, and open data could be FAIR data, but it's not the same. So if you want to keep your data in your facilities without a direct access through Google or through any other browser to your data sets, they could still be FAIR data. The only thing is that you are putting a license to reuse that data, which is more strict than simply uploading to the web. And finally, and I think it's very important, this policy and this FAIR issue will not be effective without institutional support. We need that health research institutions put on the table that they are wanting to follow this policy and that they are going to be implementing this policy from the decision-making point of view. And I think that's all from my side. If you have any question, now we have 10 minutes to discuss, so please feel free.